Hi everyone, I'm Dr. Shimi Kang, and thank you for joining me on Mental Wells, where you will learn how to protect, heal, and optimize your most powerful asset, your mind. Today we're going to talk about something I think we can all relate to in one way or another. That is anxiety. Anxiety is this term that's kind of thrown around everywhere. We say, oh, I'm feeling anxious, about the pandemic. I'm feeling anxious about back to school or back to work or whatever it might be. But it's really important to understand what exactly anxiety is and how it impacts our body and minds. Anxiety fundamentally could be defined as a fear. It really is being afraid of the unknown or something that could happen. It is really enmeshed with this idea of what if, often worst case scenarios, or what we call negative thinking traps. So fundamentally, anxiety is fear. Now, that's really important because what fear does is fear triggers our stress response. The response, that very ancient primitive response in our biology and our brains, that is important for our survival. When we are afraid, it means that we feel threatened. It means that we don't feel safe. And so it triggers that very powerful stress response. If you want to know more about that, and that's the way to really understand the fundamentals of anxiety, click on my video on stress here. So anxiety is fear, and fear triggers our survival stress response of freeze, fight, or flight. And the anxiety really is that freeze. It's being mentally frozen. It is procrastinating. It is feeling like you don't know what to do, how to make a decision. You're really frozen in fear and anxiety. Now, it's really important to understand that we are all unique. The human brain, I say, is like a fingerprint. So what might make someone feel anxious is very different than another person. So for example, I do public speaking and I speak on stage in front of thousands of people. I really don't get anxious about that. Definitely not anymore. However, oh my goodness, if I had to coordinate a dinner party and cook for like 8 people, I would literally be thrown into a state of anxiety. So anxiety is very unique. Many of us are anxious about different things. Some people have really severe anxiety. That's called phobias. And phobias are very common. In fact, some of the most common phobias are public speaking, spiders, snakes, a fear of heights. So there's some pretty standard ones that from an evolutionary point of view, we kind of evolved understanding that can be a little bit scary. So regardless of what makes you feel anxious, and it really could be anything. So please don't judge yourself or others on what makes them anxious. We are all very unique and we have our own anxieties. The important thing that it comes from a sense of fear, that it is a sense of not being safe, a trigger for that stress response, a release of adrenaline and cortisol. So that's why over time, anxiety, anxious thinking actually erodes our physical health, our mental health. That happens through that neurohormone of cortisol. So if we understand that anxiety is fear and it triggers that stress response, well, what do we do about it? Luckily, we know how to move ourselves from that survival stress response into another system of learning and living. That's called the growth system, or the parasympathetic nervous system, or the relaxation system. In that system, we don't experience anxiety because we feel safe. Now, that's easier said than done. We can't just switch ourselves off anxiety, but luckily there are some really simple but not easy activities that can help. I always go back to the simplest thing, and that is breathing. When we slow our breathing down, when we take deep breaths and expand the top and bottom of our lungs, we send a signal to our brain that we're okay. It shuts down that stress response, moves us from survival to growth. So your number one tool for anxiety is to learn, practice, and become a master of slow, deep breathing. I have a video on box breathing. If you want to know a simple technique for breathing that's really effective, click here. Another great tool for anxiety is mindfulness. Mindfulness simply means doing things one at a time, keeping our focus on one thing. And the opposite is multitasking. Mindfulness actually helps reduce our anxiety because it activates our entire brain, our whole energy system towards that task, making us feel more confident, less afraid of what is in front of us. If you want to know more about mindfulness and the power of mindfulness, I have a video on that. You can learn about it here. Now, one of the things that can happen when we have anxiety is we get into negative thinking traps. These are habits, actually, along the trail of anxiety. To give you a brief introduction, negative thinking habits are patterns of thinking that lead to kind of worst case scenario or lead to a focus on the negative outcome versus a positive. For example, one common negative thinking habit is filtering, meaning you might hear something, let's say you baked a cake and somebody said, oh, it looks beautiful and it's so moist and delicious. However, I found it a little bit too sweet for me. Filtering means you don't hear all the compliments and you just filter and hone in on that one negative comment that maybe it was a bit too sweet. That actually can cause anxiety, which is a fear that your cake wasn't liked, that you didn't do a good enough job, and now we fall into a cycle of further negative thinking. There are other negative thinking habits, things like catastrophizing. One small thing turns into a catastrophe, or black and white thinking, where things are either all good or all bad. So there is really an important need to understand some of the habits that you might fall into. We all have them. I have them. When you understand what your negative thinking habits are, you can really help your own experiences with anxiety. Other things that can really help anxiety are some basic lifestyle stuff. We need routine, regular sleep. We need routine, regular exercise and body movement. We need routine, regular social connection. Without those things, our neurons, our biology don't understand why we're not sleeping, why we're not moving our bodies. Are we hiding? Why are we not seeing people? Is there danger? So having those basics of life keeps our sense of fear at bay and gives us a feeling of confidence. So some of the basic benefits, things that you can do that will reduce anxiety and benefit your well-being are simply routine, regular sleep, routine, regular exercise, and positive social connection. Of course, I'm a psychiatrist and I diagnose and treat anxiety disorders all the time. And one of those treatments is medication, and medication does have a role for moderate to severe anxiety. So that is definitely a treatment choice. But there are also a lot of talk therapies that have proven benefits. One of them is cognitive behavioral therapy, and that actually helps unwind those negative thinking habits and puts us on a path of more positive thinking, more optimistic thinking, problem solving, gets us unstuck. So cognitive behavioral therapy, or CBT, is really effective. Other therapies could be sorting out maybe a situation in your life or a relationship that might be bothering you. That could be done through interpersonal therapy. There's also mindfulness-based stress reduction. I mentioned mindfulness earlier in this episode. And if there's any trauma, and trauma is more common than we believe or often tend to consider, trauma could be anything that individual finds traumatic to them, whether it's a childhood experience or a car accident or experience that another person may not have found traumatic. Regardless of what someone else thinks, if it triggers that stress response and moves us into that freeze, fight, or flight, then that can certainly be a traumatic experience, which can drive anxiety. For trauma, then we want to really focus on trauma-specific therapies, things like reprocessing, understanding, what happened, balanced with coping skills and techniques. So anxiety is very common. It's one of the #1 chronic diseases in our modern world. It's definitely in the top 3 burdens of disease in the Western world. And anxiety rates are rising, particularly in children and young people. So we really want to increase this conversation on anxiety. We want to reduce stigma, understand it for what it is, which is a fear. And when we approach it that way and use our own biology, use our own brain through activities like focus, mindfulness, social connection, exercise, good sleep, we can start to reduce this experience for others. So before I give today's prescription, I want to thank you for joining and taking the time to understand a really important topic of anxiety. Please leave your comments and subscribe below. Today's prescription is about anxiety. Really, what I want you to try to work on is simply understanding anxiety is fear, and we want to reduce our sense of fear, increase our sense of safety, move from survival to growth, and we can do that through so many activities. I talk about that in a video called Our 2 Nervous Systems from Survival to Growth. You can learn more about that. Click here. Thanks everyone for watching. I really look forward to hearing your comments. I'll see you next time.